Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. Today we have the pleasure of being in a dental office, but not just any dental office. We're actually in a dental office for an oral surgeon here in Costa Rica. I want to tell you a little bit about him before he starts talking. When you're choosing a dental surgeon, and not just any dental surgeon, it's important to choose the right one. One of the reasons why I'm interviewing Dr. Brenes is because I've used him for many years, and when you see somebody that has the professional attitude, the bedside manner, it brings you that comfort, and a lot of patients have been very happy with this service. So this is one of the times that, you know what, we're going to push him up a little bit, but he's actually so professional, so good that you're going to enjoy your procedure and what you're going to do. Dr. Brenes,
hello, Johnny.
Pleasure meeting you again. Well, you know what? We know each other, right?
Yeah, that's right.
Just a little bit.
Yeah.
You know what? Dr. Brenes is one of those people that when you're having a conversation about teeth, he's got a passion for it. Now, Dr. Brenes, tell us a little bit about what makes you special, because I know, I think of a dentist as just a dentist, right? And what could be so complicated in the mouth? But you have actually more training than just a regular dentist.
That's right. Well, Johnny, first of all, welcome to have you here. It's very nice to have you here. Welcome back. Well, I'm an oral and maxillofacial surgeon. I did my specialty in Colombia. I have 10 years of experience in this field. What do we do as a oral and maxillofacial surgeon? Well, we focus in surgery of the jaws. We place dental implants. We do orthodontic surgery. We fix TMJ problems as luxations, pain. We do a lot of things, especially in the surgical field of the jaws and the face.
You do wonders. You make people smile again and want to be smiling, right?
Yeah, we try to.
You know what, doctor? How about tell us a little bit about you know what? Some people don't have good bone structure and they need special. Am I saying right? Zymomatics, the ones that go right in your bone.
That's right. Well, there are different types of implants. Okay, one of them is the zygomatic implants. These implants are quite long, and they are placed in the zygoma bone. Okay, so when a patient don't have enough bone structure, we can place or we can use these kind of implants in order to give the patient a complete rehabilitation of her mouth, a complete prosthesis.
So we can get the 32 teeth back in the mouth?
That's right.
You know what? Sometimes those of you that have problems with the bone structure or things, this particular surgeon back in where I live, they're kind of expensive. But it's not about how much money you spend or whether it's cheap or not. It's that this surgery is very, very time consuming, but it's also very, you have to be precise, right?
Yeah, that's right. We have to be precise, and this kind of surgery, we have to do it in a very controlled environment. So we do it in a hospital, in a OR, that's right. And we have to do it with general anesthesia. Okay.
Oh. So, you know what? We got into this particular, but you also do implants and different. Okay, what's special about using you versus another person that maybe is not quite as qualified as you? Because you went to school for 6 years, right?
Yeah. Well, there is a big difference, okay? Because a regular dentist and general dentist, the training is about 4 to 5 years, okay? As oral and maxillofacial surgeon, we have to complete that 5 or 6 years, and additional, we have to train we get trained in the surgical fields another 4 years. So our preparation, our formation is a lot better. Okay, the knowledge of the anatomy of the face and jaw is quite big,
Extensive.
quite extensive. Okay, and that's the big difference. So we can resolve complication as very quickly, and that's a very important thing in order to think about get a treatment with an oral and maxillofacial surgeon.
So I got a new appreciation for what you do. 9 years of school. Can you imagine? Not
That's
even
right.
doing nothing in that dedication.
Yeah.
And you went to Colombia in particular.
That's right.
And then when you got back to here in Costa Rica, how long did you, were you in the socialized healthcare system too?
Yeah, I work in the Hospital Mexico for about 5 to 6 years. Okay, and then I quit off the social security, and right now I work just in my
Your own practice.
Yeah, that's right.
So you went to school for 9 years, went to work in the public sector, and then came back to private, right?
That's right.
Now, I want you guys to think about this. He studied all this time, went to the public system, but I'm going to tell you something unique about Costa Rican doctors and doctors in Latin America. You guys have an access to the most complicated cases of that's in what you study for in books. You see it actually.
Yeah, that's right. Well, the practice is very different when we are in the social security and we go to the private practice. Okay, because in the social security we have to resolve the big things, big issues of the patients with big illness, like facial fractures, tumors of the jaws, orthodontic surgery. Okay, that is quite different with the private practice, where we do a lot of dental implants, zygomatic implants, facial cosmetic surgery too, but that's the difference.
So, do you think as a physician that prepared you more for now helping on the small stuff and things, but also being prepared? Because I want you guys to know this: when you're doing a procedure, you want the most experience possible. And a lot of times when you think of people think, oh, you know what, Costa Rica is a third world country, or Mexico is a third world country, and they believe, like, you know, it's a lower level. But honestly, when you're looking at experience with a physician, they have the experience. They've done it. They've seen the big cases, so you can say that you can prepare. You're a lot better prepared for the small things.
Yeah, that's right. In this, the big advantage of the social security practice is that we are able to improve our surgical skills. So we're preparing almost for everything.
So you're almost a PhD 3 times, right? PhD 3 times you get with maxillofacial, and the experience. That's what for me is when you're looking for a doctor is experience. Well, doctor, thank you for taking the time to talk about this. But you know, you do some areas out in the face for cosmetic procedures, right?
Yeah, that's right.
We're going to go into another segment of this, but I want you guys to take care and pura vida.
Pura vida.